Hi, and welcome to the show. Subscribe at kevinimney.com/podcast. Get CME for this episode by clicking on the CME link in the show notes. Today, we welcome back Scott Ellner. He's a general surgeon and a physician executive at Peak Health Technologies. Today's Kevin MD article is Humanism in Healthcare, How to Address Patient Harm. Scott, welcome back to the show.
Great to be here, Kevin. Good to see you again.
So Scott's been on recently. To go to kevinmd.com/podcast, search for his name to hear his story. But today, let's jump right into your most recent article about humanism in healthcare, how to address patient harm. Now, for those who didn't get a chance to read your article, just tell us about it.
Sure. Well, a little bit of background. Kevin, imagine a day when you just realize that you've harmed one of your patients. For many of us, it's a real life situation. And we chose medicine to heal and comfort the most vulnerable. And so when a situation like that arises, many of us are just not prepared for the circumstances. In 2005, I had an experience, unfortunately. It was my first sentinel event. I was a fellow in the operating room. And unfortunately, the nurses who were trading out places during change of shift were angry at each other and took their eye off the patient and actually got into a fight in the sterile area. What had happened as a result is that one of the coker clamps that we were using in that operation was miscounted, even though the counts were correct at the end of the case. And that clamp was left in the patient's abdomen. As a result, afterward, instead of a just culture, which you would expect in a highly reliable organization today, it was a lot of shame, a lot of blame. There was guilt. We were ushered into a room afterward. The attorneys swooned down on us, and we were told not to say anything, not to disclose anything. And you could tell there was a lot of pain amongst the people in that room, the nurses, the techs, the anesthesiologists. And so the background from that story really led me to pursue safety and quality in healthcare and to really understand the impact it has on our physician workforce. And so that's a little bit of background of why the story came together and why I wrote about the situation and the second victim phenomenon.
So let's go back to that story that you told when you were a fellow. What were some of the emotions and thoughts that were going through your mind in the immediate aftermath?
Great question. We go through medical school. We're, really confident in our abilities. We just went through, we're the top 1% academically. And then you make a mistake and you feel shame. You feel guilt. In some instances, there's humiliation. You're afraid. What does this mean for my practice? Will I be sued? That's an obvious question. And where do you turn? So there's a lot of confusion. First and foremost, you're worried about the patient. You're worried about, okay, what do I need to do to help this patient, particularly if it's a situation that could result in death. It's a very scary situation for a healthcare professional.
So at that time, and I'm going to assume that this is years ago, did you have any support, any guidance to help you emotionally through that difficult time?
Really, aside from my family, I felt alone. I felt vulnerable. I really didn't know who to turn to. In fact, when I was told to go talk to our chief risk officer, I felt like I was, going to the principal's office. What does this mean for me? Am I going to be let go from the fellowship? And, a lot of these occurrences, these adverse events, it's not something intentionally we wake up in the morning and we think we're going to do. However, the support just wasn't there. The just culture that we strive for was just not present at the time. It was early. It was shortly after the To Err is Human article came out.
So you mentioned a couple of terms that I want to go more granular into. One is second victim syndrome. Tell us what that is.
Right. So it's a term that was coined by Albert Wu in the early 2000s. And the first victim, when there's harm that occurs, is the patient and their family. The second victim is the healthcare professional who is involved in unintentionally causing that error or that harm. And so what happens is as a result of the feelings of guilt of causing that type of harm, the practitioner can become despondent. They can turn to substance abuse. They may even consider leaving the profession. And frankly, when 70,000 physicians left the physician workforce between 2021 and 2022, we can't afford these great academicians, these great people practicing medicine. We can't afford them leaving. And so, the second victim phenomena is real. It also leads to sometimes suicide, which is very painful to talk about.
In terms of addressing these issues after adverse events, you mentioned the just culture. Tell us more about that.
Right. Just culture is a term where we really look at a culture of safety in which people feel that they can speak up on behalf of the patient, on behalf of themselves, and being able to do what's right to prevent errors. It's not a culture where we blame people or point fingers. It's a culture where we all take accountability. We take accountability for our actions and work together to learn from a mistake, to be better, so that we don't cause the same mistake from happening again in the future. And many organizations are doing a great job focusing on a just culture.
So, to see that concept in action, can you paint us a picture, could be real or hypothetical, about that just culture in action at a medical institution?
Well, in the article I wrote, I presented a real life story of a colleague who was very despondent because he had caused a small bowel injury in a patient unknowingly. The patient was dying of septic shock in the ICU. And he was advised and informed by our legal counsel, our compliance officer, chief risk officer, it's okay to show sympathy. It's okay to disclose what happened in the right context and to say, I'm sorry. Because most states have statutes or laws that protect against saying I'm sorry or showing sympathy, in which that information cannot be admissible as evidence in court for malpractice claims. And so in this situation, the gentleman felt supported. He felt comforted that he could go to the patient's husband, because the patient was in a medically induced coma, and to share what happened. And it was amazing. The husband put his arm on the shoulder of that surgeon who was, very, very hurt and despondent, and said, Doc, I can see this is really troubling you. And I want you to know that I understand and I will support you. And I know you're going to do your best to support my wife.
Tell us the importance of that apology, saying I'm sorry from the physician standpoint. How important is it for doctors?
Well, I tell you, I wish I would have known this when I was going through medical school and my training. I didn't realize the importance of it until I actually did a fellowship with the National Patient Safety Foundation as I started my training. And I interacted with Richard Boothman, who's kind of a luminary in the safety culture. He's an attorney, and he talked about the context of apologizing and saying, I'm sorry. And he had found that medical malpractice claims are actually reduced when, in the right context, you can actually apologize to the patient and show sympathy and show that you really care, and be able to inform the patient based on, the discussions you've had. And this is where informed consent is really important. Understanding that they had signed a document which you explained the risks prior.
You mentioned that apologies in most states aren't admissible or can't be used against the medical institution or physician. So are we in a situation where physicians and medical professionals have to check their state laws before issuing apologies?
Well, it's a good question, and I want to be careful that, I'm certainly not providing legal advice. What I will say is it's always best to check with your legal counsel, whether it's through your practice or your employment arrangement, your health system, to say, I would like to express my sympathy to the patient. Is it okay if I do this? I would, because most of us, a majority of us feel bad when an error happens. And so it is important to just check and make sure. You don't want it scripted. You don't want this to feel like it's something that you're being told to do and it comes across as inauthentic or disingenuous. You want to make sure that you have the freedom to say, I apologize. And you don't have to go into a lot of detail. It's just show some compassion and sympathy.
In order to create that just culture, how much of that onus is on the medical leadership, on the administrators, on the legal team of the hospital? How much of the onus is it on them?
It starts with the top, any organization. And when I say the top, I mean the board of directors. The board of any health system or institution needs to understand that a just culture is the most important aspect of creating a safe environment for your patients and your employees. And the board should hold accountable the CEO of the organization for creating that just culture, to feel comfortable speaking up, to share concerns in a thoughtful way. There's complaining, and then there's empathy and active listening. And I always say behind every complaint, there's a request. And so when somebody is bringing up a complaint, really understand and listen to what is it that they're requesting. That helps to create the just culture that people will speak up to do the right thing on behalf of the patient and for their colleagues.
Now, where are we in terms of the prevalence of just culture? Do the majority of hospitals practice that? How far are we away from your ideal?
We have a lot of work to do. There are organizations that have absolutely embraced a just culture, and you can see it, you can feel it when you go into those organizations. There's an understanding that the administrative teams are supporting the physicians in the work they do. But then, I'd be remiss if I didn't bring up the story of Redonda Vaught in Tennessee, who was convicted, I believe, of manslaughter for an unintentional medication error. It's hard to understand. I don't know all the details, but it's hard to understand how in a just culture, when a situation like that occurred, how a healthcare professional could actually be convicted of a crime because of an error. So that is an example of more work needs to be done.
So talk more about that. When medical professionals are convicted on criminal charges for adverse events, tell us the effect and the impact it has, of course, not only on that professional themselves, but on the institution and their coworkers as a whole.
When a situation like that, when a conviction for doing your job and causing an error happens, and sometimes there are egregious errors, but a conviction where there's criminal involvement, to be convicted of a crime for criminal activity means beyond a reasonable doubt. That's going to create distrust within the healthcare industry. we already have a shortage of great nurses. And you see a young professional who's looking to get into healthcare and see something like this happen, it's going to be a deterrent. And so we really have to understand the consequences here of why this happened. I truly believe, and again, I don't know all the reasons, but I truly believe it's a systems issue, and we have to explore why there was a breakdown in that type of event, adverse event, because we're going to lose great people. They're not going to go into the noble profession of healthcare.
So tell us the next steps. How can we promote just culture and have it spread to more hospitals and medical institutions?
Well, the first thing is that all administrators and boards need to go through a training on really understanding what high reliability and just culture is. There are groups out there that do a great job who will help to promote and bring this information to any organization. But it's more than just bringing it to the organization. It's walking the walk and talking the talk, and actually living it day by day. One thing that I would promote is that we be kind to each other, that we create a safe space for psychological safety, and that we have the courage to speak up, even if you're a medical student or a nursing student or a tech in the room and you see something wrong. Speak up, ask a question. Is this right? We need to decrease that fear and that authority gradient in healthcare, because it's the right thing to do for our patients and ultimately for the healthcare providers that maybe harm themselves as a second victim.
We're talking to Scott Ellner. He's a general surgeon and a physician executive at Peak Health Technologies. Today's Kevin MD article is Humanism in Healthcare, How to Address Patient Harm. Scott, as always, will end with your take-home messages to the Kevin MD audience.
Take home message for all my colleagues is that remember, we went into healthcare to support the most vulnerable. When you're feeling like you have nowhere to turn because something went wrong, there are opportunities to reach out to helplines. The American Medical Association has a helpline to discuss, if something isn't right. There's mental health opportunities. And I would say that the one thing I wanted to mention, Kevin, is the Dr. Lorna Breen Act, which was passed in 2022. There are grants out there to help with mental health and substance abuse that every institution should look into to support our healthcare professionals.
Scott, once again, thank you so much for coming on the show and sharing your story, time, and insight.
Thanks for having me, Kevin.